I'm Cathy Treadaway. I was the principal investigator on the LAUGH project, an AHRC funded project investigating how to design playful objects for people living with advanced dementia. From the LAUGH research, we developed a product called Hug, which is now commercially manufactured and available all over the world. Hug is a therapeutic comforting device. It's a soft comforter that has long arms and legs that are weighted, that wrap around the body. Inside Hug, there's a beating heart and a little piece of electronics that enables music to be played, or sounds, or stories, or poetry. Music can be streamed, or a conversation can be recorded on it. We received grant funding from AHRC to investigate how to design for people in the advanced stages of the disease. So we worked with the care home group Pobble, people living with dementia, family members, carers, as well as a whole host of different academics, technologists and science material scientists, and people with medical and psychology expertise. The lady that we designed Hug for lived in a Pobble care home where we are here. The first time she felt it, it was wrapped around her, she was sat in a wheelchair, and you could see her relax and snuggle into the softness. And the staff just were in pieces. We came back again 3 months later, and the difference in her was incredible. She was up and out of bed, she was eating again. Hug was her baby, and she was very proud of it, and that was enabling her to socialise with the other residents.
Straight away we could see a difference. As you could see, Priscilla, she absolutely loves it. And the thing is as well, it's another tool to put in place to try before having to use medication.
So we had these findings with a bigger cohort that was showing that Hug was beneficial and supported improvement in wellbeing. So at Cardiff Met University, we set up a spin-out company with their support, with the sole aim of getting Hugs into the hands of more people. So we applied for the Alzheimer's Society Accelerator Programme at that point, and we were successful. We worked with their innovation team, who helped explore ways that we could make Hug into the product that you see today.
We are all about impact. We want to make the best impact that we can on people affected by dementia. So we want to invest in the most impactful solutions that we can scale. So Hug was already showing from the various studies that had gone into it and the trials that they'd done within care homes and hospitals, the impact that had happened, but also the impact that could have. People affected by dementia were involved in the packaging and how it was going to get to market. And so I think from the research throughout, there's been that strong involvement and that strong evidence base. So that's why it was really exciting to work with Hug.
So I think for Pobble as a whole, it's made us rethink what care and support is. Some of the stories, which I could go on and on about, have been amazing. We've had individuals who've been able to go and do presentations on a stage. It's opened our eyes, it's given us some learnings and some awareness that we didn't know we needed.
To date, we've got over 5,000 Hugs out there in the world being enjoyed. Since then, we've received some further funding from the AHRC to explore further benefits. When we look at health conditions and how we might support people, there's always a reaction to use a kind of medical model. I think by thinking about using a creative and arts approach to addressing some of the basic fundamental needs, it allows us to really tap into what it means to be human. And we don't always have to respond and support people through a medical way, and arts and humanities really have a way of doing that, of tapping into that.